When you go to the dentist, is it possible that you could fix more than just your teeth? Is it possible that you could even potentially save your life? Thousands of dentists are joining the fight against skin cancer by asking you whether you wear sunscreen. While they're checking your teeth and gums, they're also going to be on the lookout for any suspicious spots or irregularities. Myles Holt is the director of the Australian Academy of Dentofacial Aesthetics. G'day, Myles.
Hi, Josh. How are you?
I'm great. Where did this initiative come from? How does it work?
Well, it came from a realisation that dentists actually fulfil a really unique position in the healthcare industry. We're kind of on the front lines. We see more patients than pretty much any other health practitioner on a regular basis. And there's a lot more we could be offering our patients than just information about their teeth and gums.
Yeah, and so how do you actually roll that out?
So it's quite simple. As you said, we're just encouraging our members to ask the question, to open the conversation. Do you wear sunscreen every day? And we're taking that lead from the Cancer Council, and we all know the slip, slop, slap and that kind of message, but despite that being going on for years, we're still seeing the skin cancer rates increasing in this country. And with figures like 2 in 3 people before the age of 70 getting some form of skin cancer, we just really need these more preventative, more general screening roles across the board in healthcare.
Do dentists need additional training to know what they're looking for?
Look, they do. It's not a great amount of training. We're certainly not asking dentists to become dermatologists and experts and diagnose and treat skin cancer, but it doesn't take much extra training just to be able to spot something and say, look, that doesn't look great. Let's refer you off to a dermatologist. And now, even with the traditional dental techniques we're doing, we do take a lot of pictures, take a lot of photographs of the outside of someone's face, and we can track any changes quite regularly, at the 4 to 6 month checkup.
It's kind of ingenious since there are very few people who peer so closely at your face than a dentist does. Is this the first time that dentists in Australia are going to be doing this?
We've had a bit of a sporadic patch of dentists doing it over the years, but now this is the first kind of routine system that we're implementing from a training perspective, and that's where our academy comes in. So it's the first en masse move, really, and as you said, it makes a lot of sense when you think about it. We traditionally think of dentists as just being teeth people, but when you think about how close we sit and how regularly we see you, and if you're like me, you kind of avoid going to the GP unless you're sick, when we can actually get to people when they think they're healthy and take on this more general health prevention and screening role, it just makes a lot of sense.
And is this going to be all dentists, or is it just people who are members of your outfit, the Australian Academy of Dentofacial Aesthetics?
So currently we've taken the lead and we've taken the step in this direction and said, look, this is something that is getting worse in Australia and we've got the opportunity to fix it. So it is our member base at the moment, and if people are interested in finding a dentist, they can jump on our website and we've got a directory of who they can see in their area. But we're hoping that with the support of the Australian Dental Association, the Cancer Council, that this can just become something that happens every time you go to every dentist.
And what exactly are dentists looking for?
So we're looking for any changes. So we call it the A, B, C, D, and E of skin cancer. So it's changes in size, in shape, in colour, and as I said, development over time, and that's something that we can track every time somebody comes in.
And how would you do that? So if you have a patient who you haven't seen for 12 months and they don't actually need an X-ray or necessarily a photograph of their face because it's just for a clean and a general checkup and their teeth are generally fine, would you have a file of a photo of their face from last time that you'd compare to their face now?
That's right. And so every time they come in, we're going to be starting the whole appointment by looking on the outside of your face, talking to you about how you're looking after your skin, using sunscreen every day, looking for any changes on the skin before we even dive into your mouth. And we'll record those changes either by photograph or just writing them in the notes and review that regularly. And we've already had some great cases where, unfortunately, some dentists have been able to pick up and spot some of these lesions and refer them off, and they have been everything from basal cell to squamous cell carcinomas and even melanomas. So it's really starting to show some benefit in doing this.
And what happens then? You just get a referral. Can a dentist refer you to a dermatologist, or do you need to go back to your GP to get the referral?
Yeah, so dentists can directly refer to dermatologists. The downside, unfortunately, is, and this is something that is kind of the next phase we're looking at, the downside is that the patient doesn't get a Medicare rebate for that consultation in terms of the dermatologist once referred from a dentist. But the option is we can refer back to their GP, who can then refer on to dermatologists. So it's a bit of double handling that we're hoping we can close that loophole too.
Yeah, fantastic. Thanks for filling us in. Good to talk to you.
Thanks, Josh.
You got it. That's Dr Myles Holt, who's the director of the Australian Academy of Dentofacial Aesthetics, about this rather clever idea that perhaps your dentist could be part of the solution to skin cancer.